Hello and welcome to Dateline Lagos on Channels Television. I'm Ayotunde Balogun. Coming up on the program, Lagos State Government to commence construction of Green Line Rail before the end of 2025. Lagos State Government declares zero tolerance to maternal deaths, and Lagos State Health Management Agency celebrates Ilera-Eko Day. It's that time of the year where the Lagos State Government gives account of the progress made in the last 1 year. And the Ministry of Transportation has announced that the construction of the 68-kilometer Green Line Rail project from Marina to Lekki Free Trade Zone will commence before the end of this year. This was disclosed by the Lagos State Commissioner for Transportation, Mr. Oluwaseun Oshiyemi, at the 2025 Ministerial Press Briefing at Alausa in Ikeja.
It's the 2025 Lagos State Ministerial Briefing. The Commissioner for Information and Strategy, Mr. Gbenga Omotosho, sets the tone for the conversation and what's expected from the various contributions.
You all know that it's been a lot, especially in transportation. When we talk about the rail, talk about the waterways, I remember on May 29 last year when so many people were involved in revelries and parties. We went all the way across the water to go and launch our ferries, 15 of them. I'm sure some more are ready to be commissioned this year. So we want to talk about all the achievements on BRT, the buses, and everything that has been done in this sector. But I would not want to take the wheel out of the sail of my colleague, who knows it better than me. But all I want to tell you is that, as you have always appreciated, because you have reported us in a manner that has made us happy, accurately, in fast and vigorous, I will implore you to continue to stay on this line.
The Ministry of Transportation takes the spotlight as it lines up all 9 agencies under its supervision to reel out the state government's achievements within the second term of the Sanwo-Olu administration. This is capped by the Commissioner in charge, Oluwaseun Oshiyemi, who gives the overall scorecard of the ministry in the last 1 year.
The Ministry of Transportation continued to embark on Traffic Management Intervention Plan, the TMIP, for junctions, corridors with a view to enforce the proper use of road carriage, pedestrian walkways, parks and garages to reduce travel time, pedestrian motorist conflicts, and improve safety of lives and properties on our roads. We have so far done 49 junctions. 3 junctions are ongoing, and then junctions that are in concept state are about 6. The ongoing junction improvement work that we have are 1, the Ikorodu junction improvements, which of course entail road and spatial modification of roundabout, lane flow segregation, signalization, question of lay-by, retaining walls, rigid pavement for Shagamu-bound flow, acquisition of bus terminals. The Iju junction improvement is one of it as well, and then the last one is the Toyin Street of Baby Road, Allen Street, which of course is meant to complement primarily the Odoyara Bridge when it's completed. The traffic expected in that axis will increase, and it's very important for us to be as proactive as we can to ensure that we do some junction improvement work so it can accommodate the proposed traffic that we expect. Looking up at the slide shows the junction improvement work that is ongoing at Okwebe as we speak. LASMA has also done a lot in the area of capacity building. They have trained 309 junior officers. I've actually gone through intensive in-house training program that has to do with operational guidelines, empathy, and emotional management. 500 senior officers attended a 2-day workshop on traffic incident management. Other in-house training on deployment enforcement strategies, stress and wellness. It's important to actually look out for the wellness of our officers because it's quite a task involved to do. Numbers of cars, vehicles, and broke down are picked by last month between year 2023 and 2025 comes to a total of 6,580, out of which 2,340 is containerized trucks and cars 429, bus 780.
Some of the state's signature projects is the rail transportation, which has changed the game in the sector. Mr. Oshiyemi gives update on the progress made on the blue and red rail line, as well as the plans for the construction of the green rail projects.
The blue line that you all know, of course, is the electric light rail mass transit. The first phase have 5 stations and 13 kilometers of track from Marina to Mile 2. The 5 stations already operational are Marina National Theatre, Igomu, Alaba, and Mile 2. The first phase has already commenced full commercial passenger operation, has transported more than 2 million passengers to date. The full line is set to be 27 kilometers, which is Marina to Okokomaiko. Construction of phase 2 from Mile 2 to Okokomaiko started in December 2023 and is expected to be finished next year. Expected to carry 500,000 passengers a day. We have also acquired additional 3 brand new rolling stock that we expect to come in May. The red line is a 37-kilometer rail route from Marina via Ito to Agbado along the Nigerian Railway Corporation right-of-way. The red line stations are Oyinbo, Yaba, Mushin, Oshodi, Ikeja, Agege, Iju, and Agbado. The phase 1 of the project is from Oyinbo to Agbado. Construction and operation of the railway system has been completed and is already commenced full commercial passenger operations. The phase 2 is going to come from Oyinbo to National Theatre, which of course will now give us that connectivity that we want. That will connect the red line to the blue line. Acquisition of additional rolling stock has already been done, has also been done for the red line. The Green Line Metro project is it's the one that will come from Marina all the way to Lekki Free Trade Zone. That is the one I call the game changer. Again, it's going to, of course, an MOU has been signed with China Harbour Czech to develop the Green Line Metro project, further expanding the state's public transportation network. The Green Line is a 68-kilometer rail project and it will run from Marina to Lekki Free Zone, like I said, and this is going to start this year.
Installation of cameras on the road is one of the measures put in place by the government to ensure road safety. The briefing provides an opportunity for the ministry to explain the speed limit policy.
The speed limit sign 1 was created not because of revenue generation. I would like to correct that. It's strictly for public safety to everyone on the road. Why do we have it? We've seen a lot of accidents over the years. And the only way we can do that is 1, ensure that we put street limits on our roads. 1, for safety. 2, the cameras that we use, they are AI cameras. They also help us in getting data of the number of vehicles that ply a particular route, online real time, which would enable us to plan against infrastructure, routing of buses or public transport into that zone. It has a lot that it does. And beyond that, it also would capture infractions. We have those ones on Allen and Olowopopo, where we have the speed limit cameras as we speak today, and I want people to please note. 1, Mobolaji Bankantoni Road, Alakbere. The one on Mobolaji Bankantoni is 60 kilometers per hour. The one on Alakbere is 80 kilometers per hour. And then thirdly is on 3rd Mainland Bridge. We've done an upgrade from the 80 to 100. It's going to be 100 kilometers per hour. The cameras are there and they will pick you. They are AMPR cameras. We have footages, we have videos that we can review and send to you if you do contest those violations.
The Lagos State Government, through the Ministry of Transportation, is appealing to residents to obey all state laws and report any illegalities observed on the road.
In compelling demonstration of progress, innovation and resilience, the Lagos State Ministry of Health presented its scorecard. Now, the Commissioner for Health, Professor Akin Abayomi, who reels out the achievements, says the progress achieved was made possible through the collaborative efforts of government officials, healthcare professionals, and development partners.
Director of Social Media in the Ministry.
It is the turn of the Lagos State Ministry of Health to give a breakdown of its one-year achievements at the state's 2025 ministerial press briefing organized by the Ministry of Information and Strategy.
360 public health facilities.
Top on the list for the State Commissioner for Health, Professor Akin Abayomi, is the steps taken to reduce brain drain and increase brain gain for medical professionals, as well as the state's government plan to reduce maternal mortality.
One of our key indicators of progress is maternal and infant death, and we're currently have the best indices in the country of 430 per 100,000 live births. In other words, 430 mothers still die in Lagos out of 100,000 trying to give birth to their children. For us in Lagos, this is an unacceptable number, and we've declared a zero tolerance on maternal death in the process of childbirth. Our target over the next 20 to 30 years is to bring that number down from 430 to 37. When we look at number of Lagosians that are covered by insurance, at the moment we're hovering around 5% of the population in a mixture of social health insurance and private health insurance. And over the next 20 years, our target is to have majority of Lagosians carrying some form of health insurance. So we have a significant problem in terms of human resources for health. It is not unique to Lagos. In fact, Lagos is better off than most states and better off than many countries across Africa. However, Lagos is the city of excellence, and so we are planning very strategically into the future to address and reduce brain drain and to increase brain gain by multiple strategic initiatives. To reduce brain drain and increase brain gain, we are introducing increased flows of funds into the health sector, improve the working and living conditions of our health professionals. We're beginning to train a much larger number of healthcare professionals. I will allude to this in a few slides. And we are also engaging with our diasporan associations in Europe, America, and across the world to facilitate the return of Nigerian specialists in from the diaspora. We are focusing on improving the living conditions of all our health professionals. We're building medical professional staffing quarters in all our new projects, and we're even going back into our old facilities to construct accommodation for our health professionals. This is an example of a project that is ongoing at the Lasuth. This is the construction of the residence doctors' quarters. We've also completed the refurbishment of the house officers' quarters at Lasuth, and the one is ongoing at Lagos Island General Hospital.
Other initiatives highlighted is the ongoing construction of the new Massey Children's Specialist Hospital, Psychiatrist Hospital, at locations including Ekpe, Ibaojo General Hospital, and other projects will also be completed in the next 12 months.
We are very cognizant of the climate change that we are experiencing. Everybody notices how hot it is becoming and how we are under intense shocks from the climate. And so we're building climate resilience into our health infrastructure into the future. On our right is the comprehensive healthcare center that's open 24/7 and supports a community of about 50,000 people. This is a picture of our new prototype design, and we've started to build 4 already, and we are about to start on another 5. We hope to have at least one of these in each of our LCDA areas. What is unique about this is the inside-outside design. It has a false roof on top of its real roof, so that you can be inside the premises, but your waiting rooms will be somewhat on the outside, but protected from the environment, so that you're not vulnerable to infection transmission from other patients. We're very proud of the fact that these facilities can be off the grid, in other words, totally independent of Eko or Ikeja Disco or generators if there's enough sunlight. This is the Shomolu General Hospital prototype derived from that master prototype. This is the Ibejuleki General Hospital derived from the prototype. And this is the Etiosa General Hospital, which will be built behind the MCC at Ajah, on that large piece of land there. The first of the prototypes that has been commissioned is the new Massey Children's Specialist Hospital. This is a 3D image, and at the moment you can see from these pictures that the buildings, both the hospital and its car park, have reached almost 70% completion. In this picture, we're taking His Excellency the Governor on a tour of the 10-story new Massey Children's 150-bed referral specialist hospital.
The Lagos State Smart Health Information Platform, a comprehensive digital ecosystem designed to unify patient records, referrals, emergency services, and interfacility communication, will also help to eliminate the chaos of bed hunting ambulances and end reliance on paper records. Government also gives assurance of its readiness to tackle any form of disease outbreak.
The Lagos State government is desirous of establishing a medical, industrial, and innovation hub to accelerate discovery and advance our ability to discover, innovate, and create value-added biotechnology, something that was critically obvious during COVID, when we realized that we were totally dependent on many imported consumables, drugs, and analytes. And so we want to make sure that Lagos is not as vulnerable as we were during COVID by manufacturing many of our own consumables, discovering our own drugs, and developing our own vaccines. And we are going to be situating this innovation zone, LASMIZO, in the Lekki Trade-Free Zone corridor. And we're working to deliver the medical city, or the LASMIZO, which will focus on medical industry, medical innovation, and medical expertise. To wrap this all up, we have what we call the Smart Health Information Platform, known as SHIP. This is putting everything together. This is a very bold digital strategy of the Ministry of Health. All our facilities will be connected: primary healthcare, general hospitals, our tertiary facilities, our agencies. Everybody is going to be connected to the SHIP, so that His Excellency, the Executive Council, and the Ministry of Health and our partners, Ministry of Innovation, Science and Technology, will have real-time data on a daily basis and be able to observe the health-seeking behavior of Lagosians and use that kind of information to derive policy decisions.
All other agencies under the Ministry of Health were also applauded for their role in ensuring quality healthcare services in the state, and the government also says it's willing to invest more funds to create a smarter, safer, and more equitable healthcare system for Lagos residents.
Lagosians, it is no news that the present administration of Mr. Governor Babajide Sanwo-Olu delivered projects in different sectors of the economy through the themes agenda. With this success in mind, the second term of the present administration has included social inclusion, gender equality, and the affairs of youths in its agenda. Now, we have the Themes Plus agenda. With this, no one is left behind on account of their social status, gender, or age. Lagosians, be prepared for another 4 years of a total revamp in all sectors. Ìgbéga ìpínlẹ̀ Èkó, àjùmọ̀ṣe ni o.
And finally on the program, the Lagos State government has marked the 2025 Ilera-Eko Day with the theme Ilera-Eko, Health Coverage for All. Wife of the Lagos State Governor, Dr. Ibijoke Sanwo-Olu, encouraged everyone to become Ilera-Eko ambassadors in order to increase the number of enrollees and reduce out-of-pocket expenses.
Agidingbi Ikeja is the venue for the 2025 Ilera-Eko Day to celebrate the progress made through the Lagos State Health Scheme. Wife of the Lagos State Governor, Dr. Ibijoke Sanwo-Olu, and other top government officials are here to support the State Health Management Agency, championing the Universal Health Coverage Initiative that is mandatory for all residents.
Ilera-Eko is more than a program. It is a movement and a promise. It is the embodiment of Lagos State government's unwavering commitment to health equity and social protection. Under the visionary leadership of our governor, Mr. Babajide Olusola Sanwo-Olu, who is the Grand Ambassador of Universal Health Coverage, we have worked tirelessly at LASHMA to fulfill this promise. We have pursued this mission with boldness, innovation, and with an unshakable belief that no one should be left behind because they cannot pay for healthcare. Now, when Ilera-Eko was launched, it was with a singular vision to protect every Lagosian from the financial hardship that too often comes with failing health or falling ill. Today, I am proud to say that we have made significant strides, progress on this journey. We now have over 1 million subscribers or enrollees across 57 local governments and local government development areas in Lagos State. This achievement did not happen by chance. It is the result of consistent community engagement, grassroots mobilization, strategic partnerships, and the hard work of our dedicated Lashma team.
You're welcome, boss.
Lagos State Head of Service, Mr. Olabode Agoro, says government has subsidized health insurance payments for civil servants to make healthcare services more accessible for them.
There is no doubting the fact that health insurance is the only way to healthcare financing and the only way to reduce out-of-pocket payment for medical expenses. On this premise, it is important to state here that the Governor of Lagos State, Mr. Babajide Olusola Sanwo-Olu, prioritizes the health and welfare of Lagos State public servants, and as such, he has committed to paying 75% of the health insurance premium for all public servants in the state. This singular effort has made access to healthcare very affordable and accessible for public servants, who only contribute the balance of 25% as their annual premium. We are extremely grateful to Mr. Governor for this very kind gesture. As if this is not enough, Mr. Governor graciously approved additional benefits for public servants in the state to enjoy the following: cataract surgery, MRI, CT scan in life-threatening emergency, removal of fibroid, cancer treatment to the tune of 5 million naira, renal dialysis of up to 52 weeks in a year, 90 days admission in case of prolonged illness, orthopedic surgery to the tune of 1 million, and treatment of burns also up to the tune of 1 million, prosthetic provisions up to 250,000. Don't you all wish you want to come and work for Lagos State government? Public servants in Lagos State are enjoying. I know that for a fact because we exchange notes. Head of services, the Federation, we exchange notes. And I know what is obtainable in other states. And Lagos State is head and shoulders above, and we're doing fantastically well, thanks to Mr. Governor.
Some of the beneficiaries and Ilera-Eko agents shared their testimonies about their experiences with the scheme.
I registered my family, and then my wife was pregnant, due for delivery, and the doctors have told us that it's going to be CS. And I asked myself, does it mean that this scheme is going to cover for the CS? And we started going at the Lagos Island Maternity Hospital, and the doctors, the staff, everybody there, they were so nice. And when it came to the day of delivery, I told my wife, I said, we still have to get some money somewhere in case they will. But from the beginning, they scanned everything. They did not ask us for any money. They did not. And interestingly, my baby was preterm, so they have to put him in the incubator session, and it costs a whole lot of money as well. So, but the day we were discharged, they did not ask any money. So I told my wife, I say, as we are leaving the hospital, don't walk too fast so that they will not think we are running away from paying our bill. And till when we left, everything was free. And I can't really express my appreciation. Ma, we are so grateful.
We all know that sickle cell is an expensive condition. It is expensive to treat, but we get this treatment free of charge thanks to Ilera-Eko.
The Permanent Secretary of LASHMA, Dr. Emmanuel Azamba, emphasizes the role of technology in the provision of seamless healthcare services to urban and underserved communities.
If you join the Ilera-Eko family for a very affordable amount, which is 15,000 for an individual per year, 55,000 for a family of 4 per year, and 80,000 for a family of 6 per year, you stand to get all the benefits under the standard JARA plan, which include all the things you would go for outpatient services. It includes admission for up to 15 days. It includes free antenatal care once you sign up for the family plan. Your wife can deliver through vaginal delivery or even have a cesarean section free of charge. We also cover surgeries such as appendectomy, herniorrhaphy. We also cover exploratory laparotomy and ectopic pregnancies for women that have maternal issues. Beyond the second year of the scheme, you have coverage for cancer cases up to 2 million. We also cover dialysis in the second year of your scheme for people that have chronic or acute renal failure. That is also covered under this scheme. We have all sorts of things that you can benefit. Just come on board and you will find that you cannot get anything better for the amounts that you are getting it for, simply because Mr. Governor has subsidized this plan and it has made it very affordable for people.
Dr. Ibijoke Sanwo-Olu confirmed that over 1 million residents have been captured under Ilera-Eko initiative, a figure she believes is not good enough for Lagos, and charges all stakeholders to close the gap.
Lagos State has 20 million and still counting, and only 1 million has been captured. So you can see we still have some work to do. Every mosque, every church, every market, every garage, every school, every hospital, every businessman or woman, council members inclusive, women leaders, politicians, area boy, area girl, no one is left behind. We need to be involved. It's not just mouth. The head of service told us that we have the standard like that of the international standard abroad. A lot of us still go abroad to access health. We have it here too. We are doing exactly something similar that they're doing abroad. But how do you encourage LASHMA? How do you encourage the health scheme if we that are seated here do not actively take part and ensuring that no one is left behind, that we are our brother's keeper? We have to be our brother's keeper. Some of us might be able to afford private hospitals. Some of us might not even be able to afford government hospital. So this is what we are talking about. We need to be part of the process. We need to encourage one another. Everybody in this hall is an ambassador to LASHMA. It's not just for us to sit down, play games, but ensure that you capture the 20 million and still counting people of Lagos State.
The event is rounded off with the decoration of the governor's wife as the Ilera-Eko icon and Grand Dame of Ikosha.
Witnessing unveiling the Ilera-Eko agent handbook. The glory of God.
Dr. Ibijoke Sanwo-Olu also launched the Ilera-Eko handbooks.
The Ilera-Eko handbooks are just unveiled by the First Lady of Lagos State.
So this is what we call it today on this week's edition of the program Dateline Lagos. Thank you so much for watching. I'm Ayotunde Balogun. Remember, obey all state laws, be the best you can, and most importantly, please live a healthy life. Till next time, it's bye for now.